Um, Thanks, Lucy, for the introduction. I was feeling quite intimidated turning up to an event where there were so many clinical colleagues that I was going to present in front of. So I've borrowed my colleague, Dr. Michelle Durham, who's a GP and the clinical safety officer for e-Referral service, to come along. So I'd hope that what we'd speak today represents what you have all been talking about, which is that whatever we do in the NHS, the patient safety and care is at the heart of it all. And that's no different to what we have been trying to do with our electronic or digital developments as well. A little bit of background to NHS e-Referral service. Quite a lot of you probably have used it yourselves or have used it as a patient or as a professional. E-Referral service, or ERS as we know of, it used to be called Choose and Book many years ago. In 2014, 2015, we refreshed the system. We made quite a lot of improvements to the infrastructure behind e-Referral service, ensure that the development methodology that we would want to use to ensure that the product was continuously updated actually was supported by the technology upgrades that were needed. E-Referral service is a national asset. It is free for use to all NHS organizations. Essentially, there are two parts to e-Referral service. There's a professional application and the patient application. Today, we will be focusing mainly on the patient application, but to give you a little bit more background into what the system is capable of and what's its purpose, essentially, e-Referral service, as the name stands, is a system that allows referrals to be moved from one clinical setting to the other clinical care setting. We have successfully rolled out e-Referral service in October to 100% hospitals as well as 100% GP practices. So basically in October, we managed something that was quite a big achievement because we went from 50% of use of the system 18 months before that to 100% use of the system. And that was only achieved by the hard work of all the hospitals, engagement with the clinicians, and us keeping up with the technology requirements that were coming through, and basically keeping users at the heart of whatever we did. The professional application is used mainly by GPs now to send referrals into hospitals. It is integrated at the hospital end with all the PAS systems, the patient administrative systems, which allows, therefore, the booking to be made at the hospital end. We also have some extra features available on e-Referral service. So we have something called advice and guidance. It allows a two-way dialogue between clinicians. So a GP, instead of automatically assuming an appointment is necessary, and if it isn't, then it's an inconvenient travel for the patient, it actually now is able to ask for an advice from a specialist colleague before making a decision of whether an appointment is needed or actually they could provide some better care for them within primary care. ERS, obviously, because it is used so heavily to manage elective care, has a lot of useful data which helps guide commissioning decisions and NHS England in managing capacity and demand issues. And then we'll come on to the patient application. The patient application was around for quite some time, but we knew that there were issues with it. We refreshed it in January 2017. That is the patient-facing website, which is called Manage Your Referral. Typically, we wanted to show what the typical journey would be in use of ERS. So a patient goes and sees their GP. The GP decides that further care is needed. The GP opens ERS, selects a shortlist of appropriate services with the patient. So this is basically what are the hospitals they would want to go. The GP gives patient the booking instructions. The patient at this point has two options. They can either call the national telephone appointment line, or they can use the website Manage Your Referral either on their tablet or their PC. The patient then logs on, they select the place, date, and time, and they book their appointment. It is pretty straightforward. I'm sure many of you, I'm a full-time working mom trying to juggle quite a lot of things. I was telling Michelle earlier, just over summer, I've used ERS 4 times for 2 of my boys. Luckily, they weren't for anything very serious, but they needed to be seen by pediatrician at specialist centers. And I used it myself, and it worked beautifully. The patient then attends the appointment. That's really the happy path. However, if the patient hasn't made that booking, for the safety aspects, we do send 2 reminders to the patient to ensure that they have made a timely appointment booking. And if at all the hospital, for whatever reason, needs to cancel that appointment or rearrange it, then the patient is asked to rebook. That's basically quite a simplified form of how the journey would flow through e-referral service. But as I said, even during choose and book days, we did have a website which allowed patients to make their online bookings. Michelle will talk more about the issues we had with those. But essentially, when we started the work on Manage Your Referral, our drivers were just very simple, really. We wanted to improve the patient experience of making the booking. We wanted it to be very convenient, and all of us really accepted that we needed a new patient booking website. Michelle will talk more about the process around it all.
So I came into this project at the start of trying to find a patient application, and as I was a GP, they felt that I had good knowledge of patients, and therefore I would be the clinical lead on this project. So we very luckily had some researchers, and the first thing we did was take out an iteration that had seemed to be exactly what patients would want and test it with some patients. And they failed abysmally at that particular iteration. It was clunky, it was difficult to use, it was full of information they didn't need. So we went back to the drawing board, and we went out and we met a lot of patients. We went to outpatient units. We went to an adult improving literacy session at a library. Some of our researchers visited people with chronic diseases in their homes, and we built up this whole profile of what patients really wanted from a booking application. And we created a happy path that was very simple. It had a login, a landing page. You select your clinic from the list available, and then you select your appointment. You review what you've done to make sure it's right, and then you confirm it. Just a few simple clicks. So we've introduced it, and I want to just reflect on what was wrong with our old application, how we got to that state, and the lessons we've learned in producing our new system. So the first thing that we came across was these universal truths. So the patient website had to look like you were booking a holiday or a hotel or a plane. It had to have a lot of data on it. It had to have waiting times, treatment times. It had to have the NHS star ratings on it. It had to have how far it was from your home, which types of transport would take you to your home, and accessibility. Patients just were completely confused when they looked at it. They didn't know what all the logos meant, and they didn't know how to choose. When we looked at where all these user needs had come from, who had decided this is what they had to have on they came from the wise and the good within the health service. They did not come from patients. No patients have been consulted. So the second thing we found is, what do you actually want on a booking application? And when we actually asked patients, they didn't want star ratings or whether the bus or the tube or the train and how long they would take, or whether there were hearing aid facilities. They wanted to just see where they could go and signposting to where they might be able to find this information. And otherwise, they just wanted to be able to select their hospital and then select their appointment. The second thing we found is that it had to be on a calendar view. But hospital appointments aren't every day of the week. So what you had was huge gaps, and then 9 appointments on Tuesday, and then you had to click the 9 appointments to see what the 9 appointments were. So what we found is if you just list the appointments that are available, there's no gaps. It's easy to scroll down and find a date and a time that actually suits you. Iterations, the other thing we realised is whatever we introduced had to be completely finished, up, running, and you just plug it in and all the patients will use it. What we discovered is that's not how it works. What you want to do is test something with patients and then see if you need to tweak it a little bit. So actually you want it to evolve a little bit slower. And in our first iteration, we had it as an option. All you could do was book an appointment. You couldn't do anything else. And we said, would you like to try out our new screens? And patients tried them out, and at the end was a little survey. What did you find difficult? We learned that our login wasn't quite right, that some people left a gap between the two words, some people didn't. So we made it irrelevant whether you left a gap or not to improve the amount of times people logged in. Really simple changes made big differences to how easily people found this was to use. The name was, you still have to type in the website, and people spell referral wrong. So we made it that both spellings of all the wrong spellings of referral would still hit the website. So really small little changes made a difference. And then piecing the data together, things have to integrate. It had to be available on all different types of smartphone, all different types of tablets, and different versions of Internet Explorer, Chrome or whatever. It had to be accessible to people. If you don't integrate it correctly, it won't work. So this is what we came up with in our final development. It's clean looking, it's easy to use, it tells you what you have to do. It has a little "if you need help" button at the bottom. When you come to selecting a clinic, this is not all the screens I'm showing you, I've just selected a few. The choices are really clear. There was something that we introduced to the professional application where local CCGs, in consultation with local trusts, can colour code trusts that are struggling with their capacity and ones that have good capacity to try and direct people towards the hospitals with good capacities. So this is just a simple colour code that says to patients, if you pick the green one, you're likely to get your treatment very quickly. If you pick the red one, you're likely to have to wait for your treatment. It doesn't stop you picking the red one. For lots of reasons, people will want to pick their local hospital, which is usually the red one. But it gives younger people who are happy to travel the chance to pick somewhere where they're going to get their treatment nice and quick. And in fact, that speeds up the treatment at the red hospital because they're getting less people going onto their waiting lists. The select appointment buttons are really easy. You just scroll down and you select the one you want. At the end of the process, there's a confirmation page, and then you get an acknowledgement you've booked your appointment. We also made it very easy for people to change their appointment. So if they suddenly realise they've got their son's assembly and they really, really need to go to that, they can just log in and hit the cancel appointment button at the bottom and rebook their appointment. Also featured, which I didn't mention, is they can print their appointment or they can save it to the calendar on their phone. Things that are coming out in the future are, when we developed this, very few people had 2 referrals within the system. They only normally had 1 referral, 98.5% of patients. But with ERS being used more and more, and with mental health coming on board and diagnostics, it is quite possible patients could have more than 1 referral. And therefore, I think this is being released actually within the next month, the ability to see multiple referrals on 1 page. So again, we've tried to keep it clean. We've done a lot of patient testing so that patients don't get confused. The appointment, the actual wording got changed repeatedly because patients got confused. And this has passed, I think it's this iteration that's passed all the patient testing and is now being produced and will be available, as I say, either next month or April. And finally, we have managed to develop a system whereby instead of giving patients a letter, we can email them and they will be able to log in with a click. This has been linked to the NHS Login, which is a new application that's been developed by NHS Digital that will hold all patients' details and give them access to GP appointments, GP records. They'll be able to order their repeat medication and they'll be able to use MYR to book in and book their appointments at the hospital. So this is very exciting. I think the summer is around release. To get to this point, to give you a little bit of background, to email patients about a clinical problem, there is an enormous amount of information governance you have to get through and an enormous amount of security so that other people don't get access to their clinical records. So this has actually taken a huge amount of effort to find a system that is safe, effective, and will work for patients. So we're actually very pleased that the solution we've come up with ticks everybody's boxes. And again, that's in development at the moment and will be available soon. Unfortunately, you won't be able to use it unless your patient has an NHS login. That's being rolled out across the country. It's just finished its pilot of about 30,000 patients and has been successful, and it will be rolled out to your area, but I know they're going to do it again in an iterative way so they can get feedback and find out if it needs tweaking. So I'm not sure when it will be rolled out to your area, but once it's there, the patients who sign up to it will be able to get these emails. So has it worked? So we launched it in January. We've been iterating it, and we didn't really make a loud fuss about it till we were really certain that it was usable by the majority of people and doing what we hoped it would do and allow patients to take control of their care. In August, we did a big advertising campaign around the GP surgeries, and we've seen the use of it take off. So last year, we had 1.5 million patients booked their own appointments. My plea to you today is please let patients, all hospitals, let patients book their appointments. We know it reduces DNA rates by over 50%. It also empowers patients to be in control of their healthcare. They are responsible for booking their appointment, for attending their appointment. They come with a better, if you're in charge, you're not letting them be empowered. So if you're a hospital trust, I know you love to be in control of appointments, but just let the patients do it. You'll be amazed at the difference. And patients are so much happier when they choose their own appointment. If they have to wait 10 minutes, they're not so upset. If they've had to get time off work, cancel things, arrange childcare, and then you keep them waiting 10 minutes, they get annoyed. So you will find all round better patient satisfaction if you let them book their own appointments. And they can also book things in sequence. If they're told you need to get your scan first and then your cardiology appointment, they will do that. So please, that's my big plea, let them do it. The other really exciting bit of news is that the professional application, which also struggles with being clunky, unintuitive and difficult to use, is getting the same facelift that the patient app had. We literally heard that we had the funding this week, and that we've already done the designs, we've already done the background work, so we will be coming out for user testing. So if you get an email from e-referrals, please look at it, answer the survey. We will be basing it, we will be coming out to trusts and things as well, but the surveys are really useful at making sure our designs are correct. So we're hoping that if I'm standing here in a year's time, you will also have this lovely looking, easy to use, intuitive and iterative application to use in the professional service.
Thank you very much.
Still got some, Lucy?
Just finishing, please.
Yeah. One of the things that we wanted to share with the manager referral bit is, whilst the application itself we've used the government digital standards to develop the website and the look and feel of it, but the real success of manager referral has required the dedication from all 150 hospitals to make sure that all their services are listed, all their relevant appointments are available to GPs and patients to make the booking. Because without that though, it would just be a website which looks fine, which is built for better usability, but actually would lack substance behind it. So in the NHS, pretty much I would assume that for all the digital improvements and developments that we do, that it needs to be led alongside the operational improvement and the service improvement that's required as well to make it happen. As we said, really, our key messages looking into the future are that clinicians, please empower your patients, give them access and give them choice to go online and make their bookings. And patients, do try our website and manage your own referral. And we can guarantee that it will save you some time and save the NHS some money and efficiency as well. Thank you.
Thank you very much.